visiting lecturer, Government College University, Faisalabad. So today the topic of my discussion is vomiting, which is basically a symptom. So the vomiting is a forceful ejection of gastric contents through mouth, and it occurs in phases. So if I talk about the phases, then there are three phases. The first phase is nausea, in which the person feels have a feeling of wanting to vomit, often associated with autonomic effects, which includes hypersalivation and sweating. And the other phase is retching, which is basically strong involuntary effort to vomit. And the third phase is the vomiting, which is the expulsion of gastric contents through mouth. So these are the phases. And if we talk about the mechanism of the vomiting, then the vomiting is controlled by basically the vomiting center that are located in our brain in medulla. And this vomiting center is stimulated by four different sources of afferent inputs, such as gastric or biliary distension, mucosal or peritoneal irritation or infection. And the second uh, source is the vestibular system, which may be stimulated by motion or infection. That's called vestibular neuronitis. And the third source is the higher CNS center disorder, yes, like sights, smells, and emotional experiences, which may also can induce vomiting. And the fourth source is the stimulation of chemoreceptor trigger zone by drugs, toxins, hypoxia, uremia, which is the raised level of urea in blood, and the radiation therapy. So these four sources are involved in a way or other in the mechanism of vomiting. And if we talk about the causes of vomiting, then there are multiple underlying disease which manifest as with the symptom of vomiting. So if we talk about them one by one, then first of all, in infections like gastroenteritis, hepatitis, and UTI, in infectious diseases, vomiting is a prevalent symptom a patient presents with. And if we talk about the drug intake, then excessive use of NSAIDs, antibiotics, and cytotoxic drugs are the causes of vomiting. And mainly, if we talk about the gastrointestinal diseases, then the chronic peptic ulcer and gastric outlet obstruction, gastric carcinoma, and gastric paresis. Gastroparesis is also the causes of vomiting. Gastroparesis basically uh, uh, is the we can say that gastroparesis is the partial paralysis, and which cause a delayed emptying of stomach. And in this case, the spontaneous movement of the muscle, stomach muscle, doesn't function normally. So it also leads to the vomiting. And some other acute abdominal disorders like appendicitis, cholecystitis, pancreatitis, and intestinal obstruction can also cause vomiting. And CNS disorder, if we talk about the CNS disorder like vestibular neuronitis and migraine, meningitis, and raised intracranial pressure can also cause the vomiting. And the metabolic disorder like diabetes, diabetic ketoacidosis, and renal failure, Addison disease, they can cause vomiting. And in case of severe pain, and patient also present with the symptom of have a symptom of vomiting. And vomiting may be psychogenic when there is no underlying cause and no history of weight loss and any other uh, major cause. And vomiting can be due to the alcoholism. So, if we evaluate the patient, then the persistent vomiting suggests pregnancy, gastric outlet obstruction, gastroparesis, and the psychogenic disorder. And if a person complains that he or she has a vomiting immediately after meals, which strongly suggests bulimia. And if intestinal obstruction is suspected, Then we can confirm the diagnosis after performing the X-ray abdomen in a erect posture, which shows the dilated lobe of small intestine, and it will confirm the intestinal obstruction, and that would be the cause of vomiting. And the serum electrolytes are also performed, as we know that hypokalemia and metabolic alkalosis may be present. And if the vomiting is not controlled as soon as possible, then it will lead to the several complications, which include the dehydration and hypokalemia, as well as metabolic alkalosis. And it may also lead to the aspiration and rupture, which may lead to the aspiration pneumonia and rupture of the esophagus. And if we talk about the management, then the vomiting can be managed or treated by using the antihistamines and corticosteroids, as well as dopamine antagonist. And if we talk about the herbal way of treatment, then the single crude drugs, which may help in the treatment and of vomiting, that are I will name them in Urdu, like Pudina, Malathi, Ajwain, Anardana, and these are very beneficial for the treatment of vomiting. And if we talk about the compound medicine, then Jawarish Narayan and Jawarish Tamar Hindi is beneficial and effective and have therapeutic effect in case of vomiting. So basically these drugs can treat the patient symptomatically to stop the vomiting, but until unless the vomiting cannot be stopped until unless you remove the underlying cause or you treat the underlying disease. So that was a brief knowledge about vomiting. Thank you.